Good afternoon, everyone, and welcome to today's panel discussion on the impact of COVID-19 on women with a focus on women of color. Today's discussion is being held in recognition of Women's History Month, and we chose today in particular to have this important discussion. Well, because today is International Women's Day. So happy International Women's Day to all my colleagues and supporting allies. I am Dr. Marcel Davis, the Director of Diversity, Equity, and Inclusion here at VCU Health System, where we are focused on promoting and advancing DEI throughout the health system and the communities we serve. Our goal is to ensure everything we do, say, and touch is done so with equity at its core. I am truly honored to moderate this discussion with my brilliant colleagues who I'd like to introduce to you now. Dr. Bergen Nelson is an assistant professor of pediatrics at VCU School of Medicine and works clinically in primary care in the newborn nursery at the Children's Hospital of Richmond, or CHOR as we fondly refer to it. Dr. Nelson conducts health services research about the system of care to address early childhood developmental and behavioral concerns and social determinants of health. She is a graduate of Harvard Medical School, completed pediatrics residency at the University of California in San Francisco, and a fellowship in public health and health policy in Los Angeles through the Robert Wood Johnson Clinical Scholars Program. Dr. Nelson serves as the medical director for Reach Out and Read Virginia, the early childhood champion for the Virginia chapter of the AAP, and she sits on several local and statewide boards that support early childhood, including Smart Beginnings of Greater Richmond and the Virginia Association of Infant Mental Health. She has two active boys, ages 7 and 9 years old, who have been learning remotely for the past year. Dr. Nelson, welcome to our discussion today.
Thank you so much. It's great to be with you.
I'm so happy you're here with us. Melinda Hancock is our Chief Administrative and Financial Officer here at VCU Health System. In her role, Melinda is responsible for financial functions, strategy, and shared services, and has helped lead the launch of the formal shared services infrastructure in the Health Innovation Consortium for the health system. Prior to joining VCU Health System in June of 2016, Melinda was a partner with Dixon Hughes Goodman, LLP, where she helped to lead the payment model team in the development of products related to the transformation from volume-based reimbursement to value-based reimbursement. Before joining Dixon Hughes Goodman, Melinda was the Senior Vice President and Chief Financial Officer for the Virginia market of the Bon Secours Health System. Melinda's career prior to Bon Secours included 8 years at Culpeper Regional Hospital, and she also has experience as a healthcare consultant and auditor with both Ernst & Young and Deloitte. Melinda has been active in her community and her professional organizations. With the Healthcare Financial Management Association, she first served at the state level in a variety of capacities on committees and through the board and officer role, including president of the chapter. At the national level, Melinda served on advisory committees, the national board, and then in 2015 to 2016, she was the national chair. She has co-authored several articles on payment reform and related transformations. Melinda serves on several boards, including the Virginia Health Information, Virginia Center for Health Innovation, VCU Health Innovation Consortium, and the Virginia Commonwealth Investment Management Company. She has been the community chair for the American Heart Association Heart Walk and the LLS Light the Night in recent years. Melinda, welcome to our discussion today.
Thank you.
Dr. Myriam Kadeba is a counseling psychologist and the interim director of the Office of Multicultural Student Affairs here at VCU. Dr. Kadeba graduated with her doctorate from the University of Akron, Ohio, and her clinical interests include intersectional identity concerns, women's health issues, immigration and international students, adjustment concerns, racial healing, and trauma. Dr. Kadeba is originally from the Ivory Coast, West Africa, and her journey throughout the United States over the past 19 years has allowed her, among other things, to engage in difficult conversations with others in the service of gaining greater understanding of the human experience. She is committed to being a lifelong learner and advocate of racial justice and liberation, using an intersectional lens to make the invisible visible. Dr. Kadeba, welcome to our discussion today.
Thank you. So honored to be here. Thank you for having me.
Absolutely. So the honor truly is mine to be here with all of you today. So please know that you were strategically chosen for this discussion because of your areas of expertise and the importance of those perspectives as we talk about the impact of COVID-19 on women with the focus on women of color. So I'd like to start by asking each of you, what have you seen in your professional spaces related to the impact of COVID-19 on women? Dr. Kadeba, would you like to go first?
Sure. I'll do that. Before talking a little bit more specifically about some of the things that I've noticed in this area, one of the first things that I wanted to name is that there are pre-existing and long-standing inequities that have been amplified due to COVID. And some of those inequities, of course, drawing from a history of racial difficulties, to use it as a euphemism, really, right? Like that has impacted the welfare of individuals in this country. So whether it's like lack of access to healthcare, lack of access to stable housing or modes of transportation, contending with chronic stress, we see really those things that have been present prior to COVID, and then the past year. Have really been amplified because of the pandemic. And the places where I've seen this really take place is for individuals that live at the intersection of race, gender, and class, and oftentimes also sexual orientation. So I'm thinking about low-income women of color or low-income trans women. So I saw a statistic recently that was talking about how low-income students have been delaying their graduation rates because of the pandemic at such a much higher rate than students with more financial means. And that impacts women of color even delaying their graduation as, again, at a much higher rate. So that's some of the things that I've been observing. In addition to that, many of the students that we interact with are first generation students. So they're dealing with more than trying to navigate their remote learning. So oftentimes they need to care for family members and assisting their younger siblings in their own remote learning, or being essential workers and continuing to balance 2+ jobs in order to be able to afford their classes, right, their education. So seeing those things play has really created an environment that has been difficult, and doing so while there's also been like continuing to deal with racial violence at the national and local level has significantly then impacted the mental health of those individuals. And if we're talking about mental health and connecting that with even a lot of basic needs not being met, it really, again, like presents as increased vulnerability for low-income women of color in particular. So we see more of like an increase in depressive symptoms, anxiety, and oftentimes even symptoms of trauma. So those are some of the things that I've been observing from that realm.
Well, thank you so much for sharing that. I appreciate it. Melinda, would you like to go next? What have you been seeing?
Sure. Well, 1,000% agree with all of the previous comments. Want to build off of some of those. Some of the things I'm seeing in my professional spaces is we as women are also the natural caregivers. And so take everything you just heard and then apply it to, okay, so how do I take care of more people? So what's happening in COVID is you have your immediate family, but now in many cases, what I've been seeing in my professional spaces is now the extended family. So, I think I've heard several cases where families are taking care of more than their own family financially due to the employment trends, due to illnesses, So I think the role of women in our broad caregiver roles, and what's kind of innate and nurturing from us from a natural perspective, has really been drawn upon. And then which then leads, I think, to some of these mental health concerns as well, because at what point, if you're not taking care of yourself, you can't take care of others. And so that tug and pull kind of has really been elevated during COVID. And in many cases, there's just a lot of women with a lot on them. And so a lot of them are making some decisions that I know we'll talk about here in a few minutes about where, when, why, how, what am I going to do next? And where do I really spend my time and energies? So I think what I'm starting to see is a lot of soul searching as well. And where do I spend my time? How do I spend my time? I'm pleased to see the awareness of mental health really rising. It's not where it needs to be. It needs to be much further along in its awareness and comfort in commonplace conversation. But I'm pleased to see at least it getting to that level. But I really am concerned about what I see as a lot of women who just feel the weight of the world on their shoulders from not just their immediate family, but from an extended family.
Agreed. Thank you. Dr. Nelson, can you weigh in here?
Yeah. So I also agree with everything that's already been said, very well articulated about the inequities and the stressors. I feel like this has been a challenging year for everyone, and I kind of think about the COVID-19 as this perfect storm of things where crisis, where people have had experienced illness and loss of loved ones. We also have had this economic crisis where many people are out of work and experiencing a lot of strain. So we're seeing in our clinic higher levels of food insecurity, trouble making ends meet, trouble getting diapers for young babies, things like that. And that's been very stressful. I think all of it just put a lot of strain. And just as has been previously said, this has really been like a great revealer, right? So it really has brought into relief and stark contrast the inequities that were already there and the gaps in our system of care that already existed. So I take care of families with young children. I have 2 young children myself, and I know that people have been very stressed, especially around school closures and childcare access and all of these things. So it's just been really stressful. We're trying really hard to support families as best we can. We're trying hard to increase our recognition of these stressors and provide support. But at the same time, we're also seeing that many services are less available in some ways. So again, it's just difficult things, and I'm just praying that things will get better because it has disproportionately affected folks who are already in a lot of inequities.
Bergen, thank you so much, and thank you all for weighing in on that. I appreciate your openness and transparency. Melinda, I'd like to turn to you for this next question because it's directly connected to the financial health of women and more broadly in the workplace. So COVID-19 has had a significant impact on every facet of our lives, and including the business and the marketplace. And the numbers are incredibly alarming when we look at the job loss amongst our population of women. The National Women's Law Center analyzed the latest job report, which showed that in January, 275,000 women dropped out of the labor force. And in December, 156 lost jobs, whereas in December, men gained 16,000 jobs while women are losing. So interestingly enough, in terms of gender representation in the labor force, we are at the lowest that we've been since 1988. So interestingly enough, what can you share with us about this phenomenon and how, in your opinion, will it impact the marketplace going forward?
How long do we have? Yeah, these statistics are amazing. So, on one hand, I applaud that women have choices, that we do have these options and choices and that we have the flexibilities and hopefully to move in and out of the workforce. But we also know that it is also still difficult in many professions to move in and out of the workforce equitably. So I think that's our challenge. So I think what is this, so if we think ahead, what are the implications of this last year of this? Well, I think, a couple come to mind. First of all, we've seen all the studies in the last decade of the representation of women on boards and how that really adds to the richness of the voices at the table. So obviously that's going to have an impact there. I think you can then apply that to what's the representation of women in all levels of an organization and how does that play forward? So from a candidate pool perspective, when you're looking to do your recruiting, benchmark representation, there's all sorts of downstream impacts. I think we're going to see this for a while to come. And is it going to be pre or post 2020? I think this is going to be one of those balancing barometers that when you're looking at a benchmark from a gender perspective in the workforce, was that pre or post 2020? Because I think this is going to be a big change and shift in how things are represented from whether it's a pay perspective or representation in a candidate pool perspective. I think from the recruiting firms, I think are going to have a hard time getting a representative sample, when they're trying to fill their candidate pool for their clients. I think this is going to have a number of ramifications. So those are some of the things I thought of. I'm sure my colleagues may have some to add to that as well, but I think there's probably things that we'll be seeing for a while to come.
Absolutely. Myriam, would you like to weigh in?
Honestly, I just could not agree more. Really, and I've been thinking about that a lot. What this year, the repercussions of that as we move forward, how different it would look like. I think to the point where we may try to even think about what it may look like, but in all actuality, it would likely be so different and have like ongoing that we can even like fully grasp right now. So I could not agree more with Melinda.
Thank you, Myriam. Bergen, would you like to weigh in?
I think so much has already been said. I think it's really true. I love that. I don't love it, but I think that's really right on that kind of pre or post 2020. This is going to be an historic benchmark for all of us. But that labor force statistic that you presented is really striking. And I think it's going to take time to recover. It reflects the kinds of jobs that women have had and the fact that so many frontline essential workers are women, are women, but then a lot of times the kinds of hospitality industry and restaurants and things like that have really taken a disproportionate hit in terms of our economy have also affected women. So it's just, I'm sorry to have to say that there will be some long-term ramifications for this. We're going to have to recover.
Agreed. I literally remember where I was and what I was doing when I saw the statistic for December. And I was like, wait a second, what? I had to go back and research it. And I thought that source has got to be wrong. And I kept looking for other sources only to confirm that, it was right. So it's alarming. So thank you all for sharing your thoughts on that. And so the expertise that you all bring to the table cover both clinical and non-clinical roles. So based on what you know and what you've seen in your roles, what do you think the employment landscape looks like in the healthcare industry for women? And is that landscape different for women of color? Dr. Nelson, would you like to go first?
Sure. Yeah, I think it's a really important question, and I have to, with full disclosure, I'm speaking from a place of great privilege myself. I am a woman, but I'm a white woman, and I've had not necessarily experienced the racism and the inequities that many people are describing, and but I do think that the healthcare industry has changed a lot because of this pandemic. And I think about the healthcare industry not just as physicians, obviously, but as all of the people that make the healthcare industry work. So that is nurses and care partners and the folks that do food services and the environmental services and the front desk folks and the call center folks and everybody who makes this system operate. And we have, just looking here at VCU Health System, we have a lot of women of color in many, many, many different roles. And I think that because of the inequities of who has been affected by COVID-19, who has had worse clinical outcomes, who has lost family members, the kind of disproportionate stress that we discussed before in terms of balancing childcare duties and working, all of those things affect all of these women. And, you know, again, I am in a position of privilege, but it's been stressful for me. So I can imagine, I can try to, you know, experience or understand the experiences of people who may not be in the same position in terms of those privileges. So I think, again, we're going to have to look at those inequities and think about the landscape and how can we support people. I think as a health system, we need to really offer support at all levels to address those stressful experiences people are having, and how can we really have kindness and compassion and support for everyone in our system.
Agreed. Thank you so much for sharing that, Dr. Nelson. Dr. Kadeba, would you like to weigh in here?
Very similarly to what Dr. Nelson mentioned, like really being able to understand like how different personalities, right, like different identities can then impact how, you know, some of the repercussions from the pandemic. And as I mentioned earlier, like it continues to be important to anchor not only like support that we can provide to individuals in the healthcare, but even our understanding of the impact of COVID, like really anchoring that in the history of racial, gender, and class bias continues to, in many ways, right, like minimize, negate, and devalue the experiences and the needs of women of color. So, you know, I think Dr. Nelson has mentioned, right, like these difficulties are even more impacting women, and then compounded with like other identities that women are holding, like being women of color. And I think the healthcare industry, having been one of those that has been like significantly impacted with a lot of like job losses and individuals like really lacking security around like being able to make any sort of like not only current planning but also like future plans if you're not even sure whether you'll be able to hold the job that you have while your responsibilities have also been increasing. And then you put that in mind, like trying to prioritize caring for yourself and caring for your own needs, your own basic needs. Like there's just a lot that is coming into play that can make it very difficult for these individuals within the organizations that we're all part of to thrive. Sometimes before even getting to thrive, to even survive in that environment.
Agreed. Thank you, Dr. Kadeba.
I think the only thing I'd add to my colleague's statements is when I look at the question, employment landscape, when I look out, I think the employment landscape looks good for women. I think though our challenge is we need to go back to the source and say, are we sourcing our candidates in the right way? I know, like for example, when I go to CFO meetings, it's not a diverse group. Why not? So I think we need to look at a variety of different positions and say, what do we need to do about that? And it's more than just saying, hey, I need a diverse pool. It's a tremendous amount. It's more than that. So what do we need to do about that? How do we get to the source of that? And how do we be much more intentional about making sure that we are encouraging diversity at the educational source? And I mean, very few people wake up and say, I want to be an accountant. So, and I get that, and I own that. But for those who perhaps I didn't know that I wanted to be an accountant until I went to college. But so how do we help people explore that better from all different backgrounds, and do a better job? And I know we can do a better job.
Yeah. Melinda, thank you for that. Ironically, my sister is a CPA, and I think she woke up thinking she wanted to be an accountant. I appreciate that. Dr. Nelson, I'd like to direct this next question to you if I could, because your role as a pediatric physician is unique. I think it's true because you're treating our children and adolescents, but you're also connecting with and working with the families of those children and adolescents. So the question is, how are you addressing the fears of contracting the virus and medical mistrust amongst this particular population?
Yeah, it's a really important question. And I think, like I said, my personal experience is very different sometimes than some of my colleagues or the families that I work with. And so what I try to do clinically is something we call shared decision making, which is really about offering information so folks are coming from a place of being informed, but then really respecting patients and parents and families' own decision making about what is right for their family. And so I try to be a partner in that by providing what I know from the data and the science. And also I just in general try to reassure folks who are anxious all the time. So we have many, many anxious new parents, and I really enjoy that role of being a reassurer, sort of a comforter. But it is challenging with COVID-19 because it's such a scary virus in many ways, right? We've had unprecedented loss of life. More than 500,000 people in this country have died. So we cannot deny that it is very scary. At the same time, it's so baffling because it can be deadly in one person and asymptomatic in another. And there are many, many people I've taken care of who have had COVID-19 and had very, very mild illness. And I can't pretend to know to be able to predict who's going to have a severe course and who's going to have a mild course. Thankfully, in general, young children, especially children who are healthy and don't have underlying medical conditions, have had relatively mild illness. So we haven't had as much hospitalization and death. However, there are some children with underlying medical conditions. And so I try to be, again, a partner in that decision making. So if a family has a child that has medical vulnerabilities, or there's somebody in the family that has medical vulnerabilities, we try extra hard to protect those families. And then it's really about that individual kind of risk benefit calculus. And so we do the best we can to provide the information so that people can make what's best decisions for their children. Like I'll say for my children, I felt like I have two pretty healthy school-age boys. I've been thinking, them being out of school actually has caused more harm, I think, than the effects of the virus for them as individuals. But yet I can't necessarily say that for all families. And so we have to have that really individual risk and benefit kind of discussion.
Understood. And Dr. Nelson, thank you for sharing that. And Dr. Kadeba and Melinda, I don't know if either of you get this, because I know I get it. Well, you work in healthcare, so you must know, right? And it's like, well, I'm not on the clinical side. So I'd like to share this question with you as well, because you may get the question too. How do you have a conversation around fears of contracting the virus and medical mistrust amongst any population?
Yeah. So of course you become an expert in all things healthcare when you work in healthcare, regardless of your position, and so I just go to the science. So, I love what we've been putting on our website. For any of you on Twitter, we have our Mythbusters. I think it's fact versus myth. So, I love that we're doing that. And so I try and retweet that when I think I'm behind. But I think it's important to say, no, let's break this down. What's a myth and what's a fact? And it doesn't mean that's going to instantly, get rid of any fears, but let's at least start there. And then who can you have the conversation with? I'm not the best person for you to have a conversation with because I am an accountant. You don't want to have, should I have the shot with me? call your doctor, call your trusted provider. Find a trusted provider. If you don't have one, hey, we can connect you with one. We can help with that. That's where I can help. So I try and break it down to what I can help with. Now, if you got a bill, I can explain that. But I try and say, okay, so where can I direct people? Where can I help? I don't want to do the whole I play one on TV, so let me try and advise you. But I do try and say, here's what I can help with, and let's break this down and find out what's real.
Agreed. Thank you so much, Melinda. Dr. Kadeba, would you like to weigh in?
Sure. One of the things that I add is I oftentimes share my own perspective as a means to help normalize their experience, help normalize the fears that they're experiencing, and really also validate that, right? I think oftentimes when people are coming and seeking out any sort of support, right? They're coming from a place of fear. And so I find that before even being able to address the facts versus reality, something about being able to normalize and validate what they're experiencing goes such a long way in being able to then build that trust that would allow them to be more responsive to whatever resources that you may provide. So I would say that that's some of the ways that I've been able to attend to it, and even really again naming that the mistrust that they're experiencing is warranted given what has been going on in the country, and practicing both ends and allowing them to gain more information in the hopefully knowledge is power, right? Gaining more information would then allow them to make better informed decisions about their needs and their well-being and that of their family.
Great. Thank you all so much for that. I appreciate it. Dr. Kadeba, I'd like to direct this next question to you, if I could, because it's related to your expertise as a psychologist. So it's no secret, right? Because we've been talking for the last 40 minutes about the impact of COVID. So it's no secret that it's caused a crisis in women's mental health. We've been talking about it some today. If you watched the special last night on television when Meghan Markle talked about her personal experience, it's a crisis, right? So I'd like to take that one step further and ask, what has the crisis done to women of color?
I'm so glad that you brought that example, actually, from Meghan Markle, because I've been just sort of following on Twitter what has been the response, and the response particularly from Black Twitter and Black women on Twitter has been so overwhelmingly embracing of how important that message is, to have been able to just name, right? Struggling with things like depressive symptoms or struggling with suicidal thoughts, and really being able to explicitly name that that's what we're experiencing. I think there's continues to be stigma related to mental health concerns in a lot of communities, particularly communities of color. But what I've seen since the pandemic is almost a sort of radical need and to really be explicit about our needs. Right, a lot of women of color, a lot of Black women have been naming, we are struggling, and the resources and access that is available does not adequately meet our needs. And it is not happening in a vacuum. It's of course part of a history and a legacy that has been present, but there's really a lot of energy around needing to shift that. I've seen it in being able to even recognize that the way that mental health concerns look for us may be really different from the way that we understand it from a Eurocentric standpoint, right? So being able to even recognize that somaticization is a thing, right? Being able to hold the way that we hold anxiety and depressive symptoms and chronic stress looks and feel different depending on even the identities that you're holding. So I've definitely been seeing that, and with that I've also seen a push towards connection and figuring out ways that women and women of color can get together in that virtual world. I think it's allowed for connection to be much more accessible well, to some extent, right? Because understanding that even having internet access continues to be a privilege in our society. But I've seen a lot of groups and support being developed, folks sort of like organizing to be able to take care of their needs and go back to communal way of taking care of themselves and the needs of other women and women of color in their communities. So those are some of the things that I've seen in terms of like mental health.
Thank you so much for sharing that. You know, you're right. It's tough to say it out loud. A lot of the times there's some, for some reason, a shame that goes with that. And so I appreciate you weighing in on that. That's an important thing for us to think about going forward, and how to help and support our women of color. So this next question is to help us get a better understanding of what we as a health system are doing to support women in the various ways that they need based on what your expertise touches. In other words, as healthcare providers with a very large footprint, not just here in Richmond, but also in the broader Commonwealth of Virginia, I'd like to ask, what are some of the ways that we as an organization, as a health system, how are we supporting our population of women, both women who work here and women who are treated here? Melinda, would you like to go first?
Sure. I think generally, I think we've been doing a better job in recent months on really trying to do more of a focus on wellness, recognizing how important wellness is, not just to women, to our entire workforce. But I think, I'm hoping more and more women are taking advantage of that. I think it's important that we offer those services, that we continue to think of the different ways that we offer the services. This past year, we've added a lot of benefits to our health system in a time where every health system is going to react in its own needed way. We chose to put our team members first, everybody deemed essential. But then how do we continue to support and add benefits and really do what we can to try and help take what we can to help support our team members? A big piece of that too is wellness. Coming to work every day, prepared to work, but then also you have to go home and be prepared to take care of your family. And it's a holistic approach. We taught, I remember years ago, being advised, you got to be able to separate home from work. I've never been able to do that. I can't do it. So I certainly don't ask any of my team members to do it. It's about being healthy in both places. And so that means we need to invest in helping find that mindfulness in both places. We've also, I'm sure Dr. Kadeba can expand on this, but we've also been trying to offer up a higher supply of our services. So I'll let Dr. Kadeba speak more to that, but recognizing what can we do? How do we ramp up our services? We recognize, I think we're just the beginning of recognizing a higher need of a demand and more to come. So I think we have to continue this conversation of what else do we need to continue to add, whether it's a wellness or it's specific behavioral health services. We need to keep having these conversations. So I think it's just so important because we have to look at all of our team members and our patients holistically, and I'm very proud that we do that, but I also know there's more to do. So.
Indeed. Melinda, thank you so much for that. Dr. Nelson, can you share?
Yeah, sure. So first of all, as a team, I think that the organization has really stepped up. I've felt it, that emphasis on wellness. I love personally taking advantage of some of the, food offers and things like yoga and Zumba and all of those kinds of things. I was very fortunate to get a Wellness in Action grant, and we were able to do a small group of mindful self-compassion for healthcare professionals, which was really a wonderful opportunity, a partnership with the Inner Work Center, which is a nonprofit that works on mindfulness in Richmond. We had a really talented faculty member do a series of Zoom sessions with a small group of physicians and really think about self-compassion. Really, a lot of us are in this profession because we're really good critical thinkers, and we can become our own worst critics in many ways. And this is a way to kind of rewrite the way you talk to yourself and think about our common humanity, that we're all in this together and we can support each other. So that's been really helpful, just learning some concrete skills and perspectives in that way. And then in terms of how we are taking care of our patients, really, I do a lot of, primary care pediatrics. And again, we've seen an increase in depression and anxiety and food insecurity and housing problems, all sorts of things related to both the health and the financial crisis that we're experiencing. And unfortunately, this has pushed us, for better or worse, it's pushed us to really innovate, to do better about screening and identifying those concerns and connecting families with resources. So we have diapers, we have wipes, we are going to start a program called Prescription for Food. We're writing prescriptions for food banks to get folks actually a physical, tangible resource. And so I'm very proud to be part of this team because we are pulling together and taking care of each other and really working hard to see how we can best support our families. There's still a long way to go, but I'm proud to be part of the team.
Wow, that's amazing, Dr. Nelson. We've got so much good work happening here. Thank you for sharing that. Dr. Kadeba, would you like to weigh in?
Yes. I was also smiling and just thinking like it's really great that there's so many programs and things that are available for not only for workers, but also for the patients that are being seen. Some of the things that I was thinking at the organizational level to be able to support both staff and also patients. Like I think about some of the structures and policies that are in place that to some extent, right, like really magnify the inequities that are available. So really encouraging departments and organizations to look at those policies and think about what are some ways then that you can attend to those, right? So whether it's engaging in some training to be able to increase multicultural competence, to be able to decrease bias, right? To really figure out like what are some things that are currently in place at the system level that make it difficult for our employees and our patients to be able to receive care that they need for them to be able to continue to navigate the pandemic. So that's some of the things that I would mention. I think very similarly to what my colleagues have named, completely agree with everything that has been shared. And sometimes I think about how being able to foster an environment of like true, genuine appreciation and care and compassion can go a long way in being able to help workers feel like, okay, we're working hard and those efforts are being seen. So being able to even like regularly check in with folks and being like, what is going on? And there are some resources that are available, and this may be a more difficult period. And knowing that winter, for example, is one where we generally see an increase in mental health concerns, but then given everything that has been going on with more isolation, right? Being able to even actively reaching out and checking in on your workers, like really communicates, again, I care, and I may not be able to provide those services, but what are some things that I can do and be flexible in order to, to help you get connected to those resources. I think those things can really go a long way. And again, looking at some of the economical differences within the environment, within the department itself. So like potentially working to fix the income gap that might be present with, your employees, right? Looking at those things to then try to lessen the burden, the heaviness that Dr. Nelson named that like a lot of women, particularly women of color, are experiencing. So those are some things that I would name at the organizational level that I think could have impact.
Wow, as you all were sharing, I couldn't help but think about from the outside looking in, unless you're within the VCU, you really don't have an idea just how much phenomenal work is happening here. And to hear you all talk about it, wow. I mean, even working here at VCU, because I'm not directly in your areas, I didn't even know half of those things. And so it makes me so proud to be here because we're doing so much to create meaningful change. So thank you for sharing all of that. I appreciate it. So I'd like to ask this final question. It's more of a call to action for us, not just as women, but as individuals more broadly across the call. What action will you take personally to change this narrative, and how can you help us to do that? Dr. Nelson, would you like to start us off?
Sure. Well, I think, we're trying hard in clinic, all those things that I mentioned in terms of really supporting families as best we can. I will say, personally, I think one of the sort of rays of light, bits of hope that we've had has been the development of safe and effective vaccines against COVID-19. So I am really proud to have been vaccinated myself and to really support, talk about the sort of myths and myth busting that we can do. I can be a communicator to folks with vaccine hesitancy and really encourage folks in the community and in my circles of influence to get vaccinated. So I think that's one way we can think out of this pandemic. And then, like I said, there's going to be a lot of healing and recovery work that we need to do together. And I hope that we can hang on to that kind of cohesion and kindness and compassion that we all kind of tried to cultivate during the midst of the crisis, that even when the crisis is over, we can all use that compassion and that togetherness and that connection, that common humanity to really work together to try to rebuild and to have more equity and to get rid of some of the stressors and to really to pull through together in a hopeful way. So,
Dr. Nelson, thank you for sharing that. Melinda, would you like to go next and share?
I had one answer to this, but I'm going to change it because I think what you said, Marcel, is so important. I think it's so important that we continue this conversation, that we listen, that we probe, that we dig, it's just so important that this conversation isn't just about panels, isn't just about projects, isn't just about snapshots that we take. It's got to be part of our living, breathing, who and what and how we are, how we take care of one another here, how we take care of our patients, how we care for our community, our neighbors, our family, and so I just think it's so important that it just becomes part of just the ongoing part of who and what we do.
Yeah, Melinda, thank you for that transparency. Appreciate it. Dr. Kadeba?
Yes, Melinda, I really love what you said around it being like more than just what we do, but also who we are, right? Like really working to embody those things. And, when I think of when I thought about this question, that's really what resonated for me. And all the things that I've named, like even as recommendations of things that we've discussed, like I've been thinking a lot about, like, what are some ways that I can enact those things myself, right? Like, how can I be the kind of leader that attends to policies that are in place in the department that I'm in to help support my staff and also to help support the students that I interact with? How do I check in? How do I do those things? How do I show up authentically as myself, right? Like as this African Black woman, how do I show up fully, given all the stressors that are in place? And how do I even interrogate and question some of the pressures that I might be experiencing in the service of my own well-being, right? Like, how do I prioritize that? And really, again, in the spirit of modeling, like, and being my authentic self, being able to have conversation like Dr. Nelson was talking about, like to help debunk some of those myths. So I'm not yet vaccinated, but I'm planning on being vaccinated. So being able to say that, to have those conversations with my community, or even being able to explicitly and even candidly share that I go to therapy regularly. And that support has been invaluable to me. And being able to foster that and encourage folks to engage in that way, right? Like having access to my support system and staying in solidarity with the women across the globe that I'm connected with, really figuring out some ways to take care of myself in my well-being, and figuring out some ways to then expand from that, to be able to have the impact that I hope to have. Those are some of the ways that I hope to change the narrative and hang on to even like little bits of hopes for myself and for my community by and large.
Yes, agreed. Thank you so much. And I know today was such a learning experience for me. So I can say that my personal takeaway is that I need to listen more, so that I can learn from, colleagues like yourselves, and it helps to inform my path forward. So that's my personal roadmap. I appreciate that. And I'd like to turn to our audience now to see if there are any questions. Anyone out there in our virtual audience, if there are any questions that you'd like to ask, feel free to type it in the chat. We've got someone, one of our team members and colleagues is manning the chat for us. Oh, and just like that, we have a question. What are some of the ways each one of us can support our female family and friends during such a difficult time?
Melinda? I got this. I got
this. Well, I had actually written this down and hadn't said it yet. So I was like, oh, perfect. So, all right. We women, we like our little touch points. So, one thing that's been a challenge with our pandemics is we don't have as many touch points. And so one of the things that I'm actually trying to do a better job of, because I've noticed I am longing for my girlfriend touch points, whether it was my cousins or whether it's family. But if you notice, we women do more touch points. So, in being a little bit more isolated, even though, yes, I come to work every day, much more socially isolated. We don't have our little touch points, whether it was book club or whatever it was, just on the street, whatever it may be. Those little reach outs mean a lot, especially to someone who might be struggling or who just need that little pick me up. How many times have you run into somebody and you're like, oh my gosh, you are exactly who I needed to see today. And, those are few and far between for the last year. So I think just starting as simply as that, double your touch points. It can be text, it can be emails, it can be, friendly Zooms, but the touch points are important.
Yes, agreed. Melinda, thank you. Dr. Nelson or Dr. Kadeba, would you like to add to what Melinda's already shared?
Yeah, I think that touch point the idea is really, really important. And I've experienced that with my own friends and family. I think we all get a little bit of Zoom fatigue, but sometimes doing like a, Zoom happy hour where you can incorporate some fun thing, like a little activity, a glass of wine, whatever it is that you need to sort of make it fun. I will say my mother is a woman that I really admire. And unfortunately, I lost my dad at the beginning of 2020. And so she's been alone and very isolated during this whole year. And I've made a real effort to call her. I call her almost every day when I drive home from work, just kind of as a routine, just to touch base with her and see how she's doing. And it's been wonderful, actually. I feel like we've gotten closer, even though I haven't seen her in person very much. I've been able to talk to her almost every day. So we're kind of sharing our daily lives. And I think doing that with the people that you really care about is really important. Really investing that time.
That's great. Thank you so much for sharing that. It's so important. My mom and I used to do that every morning and every evening before she passed away. And so now sometimes I call my sister. So thank you for sharing that. Dr. Kadeba, would you like to add to what our colleagues have already shared?
Yes, I was just sitting here in reflection and thinking about even my own relationship with my mother, as you were both sharing, and those touch points, how meaningful they are. One of the things that I try to practice is if somebody comes to mind, I try to extend a text and something to reach out. Oftentimes it's like, you've been on my heart, and just wanted to let you know that I'm thinking about you. And the feedback that I've received is that it goes such a long way, because we have no idea what they might be experiencing at that moment, but that moment and that connection really means a lot. Another thing that I would say would be to even directly ask, what is it that you need? I think oftentimes we can assume or think about like they may need something based on what we might need, but even being able to directly ask, what is it that you might need and how can I support you, goes a long way. So I've had friends or loved ones that would say, I have no idea what it is that I need, but for you to even ask allows me to feel seen. So thank you for that space. The last thing that I would say is, I think because of so much of what is going on, there's been a lot of conversations around the things that we're struggling with, the things that are difficult. And oftentimes being able to talk about things that like feel warm and fuzzy, right? Like even tapping into whatever little aspects of gratitude that we can goes a long way, or talking about the mundane. That also goes a long way, right? In helping sort of like taking perspective around like there is so much hardship and there's also other things that we can tap into. Of course, doing so in a genuine manner and not like, as I call it, like rah-rah gratitude, but really being able to connect on other ways, I think can go such a long way to just helping put like some balm around some of the difficulties that are being experienced.
You know, if I could add into that, Dr. Kadeba, our dean of our medical school, Dr. Peter Buckley, actually had an article published in one of his professional journals about gratitude and resiliency, and it was wonderful. And I actually shared it with my family, and it's really very helpful. I find myself, even when I have a dark day, that if I am very purposeful about, okay, so what am I thankful for right now? Yeah, I can list a million things that are so not going my way, but let me talk about the things that I'm truly grateful for. And it really does change your perspective. But, I wish I could think of the name of the article, but it's something about, gratitude and resiliency. It was fantastic.
Absolutely. I'm so glad you shared that. Yes, that's exactly it.
I'm writing it down because now I have to go Google it. Thank you for sharing that. So before we close, I'd like to ask you amazing, brilliant colleagues, is there anything that you'd like to add that we haven't already touched on just before we wrap up our conversation today? Melinda, would you like to go?
I think a lot has been said, and I would just add to have these conversations among other. I mean, here's a great idea for a new Zoom. Go ahead and have these conversations among other groups of women, and because I think they're rich, important conversations that need to be had. So don't wait for a formal invitation. They're just so important. So just would invite the conversation to keep going from here.
Yes, agreed. Melinda, thank you so much. Dr. Nelson, anything you'd like to add?
Yeah, I guess the importance of women, as women, really taking care of ourselves and supporting each other. I think, we talk a lot about wellness and self-care, and I don't want to make that a trivial thing. I think it is doing whatever it is that lifts you up, that expands your energy, that makes you feel good, that speaks to your purpose, whatever it is that helps you fill your own cup. You really try to do that in a really purposeful way, just like that gratitude practice that Melinda mentioned. I think we spend so much energy taking care of others, and you really have to do that for yourself first.
Agreed. Thank you so much, Dr. Nelson. Dr. Kadeba, any final words?
I would say the filling your own cup would also be my parting word. Thinking about all the ways that we care for others, and whether professionally or personally, and how difficult and draining it is to try to function when you're on empty. And really thinking about, I think about Audre Lorde and what she said around how taking care of oneself and your needs is really a radical act, right? Like it's a radical act of survival. I'm paraphrasing. But thinking about that as like taking care of yourself in whatever ways that you're able to, is then like sort of like the lens in which then allows you to go and do what it is that you need to do to take care of your family and your community. So that is something that I could not emphasize enough.
Agreed. Thank you all so much. The nuggets that you shared has been tremendously helpful for me, as I'm sure it has been for our virtual audience as well. Before we close, I want to say again, thank you. I have learned so much from you. I feel like today, being International Women's Day, it was so incredibly important for us to have this conversation, to learn not just how COVID is impacting us, but to learn how we can continue to support one another. I think that is the underlying theme today. So I, for one, I'm incredibly grateful to have you all as colleagues and friends, and I am grateful to be here at VCU Health System with you and the rest of our colleagues. And I want to bid you a fantastic rest of the day.
Thank you.
Thank you.
So much. It's been a lovely conversation.
Agreed. Y'all have a good day.
Too.